Good morning, Clinical History, present by Amy Pozo, Jenny Forero, Angie Rojas, and Santiago Gomez.
Hi, I am Jenny, and today I will talk about the medical history and the physical examination since there are two similarities between weeks, specifically the general format since each one contains a history of the occurrence. This in medical history is one present the same order in the same time of the content. However, there are important differences. The medical history is a valid and legal document. It begins with analysis and in case you are a minor in which had to read auto paint with your parents or the guardians. The five main components of the medical history, the subjective data that the pains give us, the objective data that we will obtain during the physical and the complementing examination, diagnosis, forecasts, and treatment.
Characteristics of the clinical 1. Comprehensions. A user clinical history must gather information on aspects scientific, technical, and administrative related to health care. 2. Sequentiality. The records of the provisional health service must be recorded in the chronologic sequence in which the care occurred. 3. Scientific rationale. For the scientific criteria in the completion and register of health action provided to users so as demonstrated in the logical, clear, and the complete way and the procure what was done. Availability is the possibility of using the medical record at the time is still need with the limitations imposed by law. 5. Opportunity is the completion of the care records of the clinical history simultaneously or immediately after the provision of the service or course. Opening and identification of the clinical. The identification of the clinical history will be made with the number of the citizenship card for those of legal age, the number of the identification card for the minors, and data shows as full names, surnames, and marital status, date of birth, age, sex, occupation, address, and the telephone number of the resident and place of home. Another part of clinical history are reactions for consultation and describe why the patient goes to the appointment, what the specialties, and what is the element you present the discomfort you feel at time moments or face in previous days. And current illness is the one of the most important parts of the medical history, fundamental because her the symptoms that the person has present are explaining every time that happening is recorded in an organized way. Patient medical history, morbid background, gynecology, obstetric history, epidemiological background, who does he live with, patient habits, smoke or drink, what are the medications you are taking regularly, allergies present, social background, family background.
Okay, patient confidentiality. Confidentiality is related to respect for persons and involves the patient exercising his or her autonomy in providing information to the dental professional. Confidentiality is a critical aspect of trust and has a long history of use in healthcare. The requirement for confidentiality is mentioned in all codes of ethics, uh, as well as in the Hippocratic Oath. Trust is necessary for the exchange of personal and intimate information from the patient to the clinician. A patient has a right to privacy concerning his or her medical and dental history, examination finding, discussion of treatment options, of treatment choice, and all record pertaining to dental and dental hygiene care. This privacy extends to the way in which information is gathered, stored, and communicated to other healthcare professionals. A discussion about patient is history or treatment is not to be shared with suppose family or friends. To do so is a violation of confidentiality. Information about patient can be given to other healthcare professionals with the patient permission. Okay, registered dental professionals have the right to receive confidential information from a patient as part of that patient's treatment, but with that right comes the obligation. Uh, Keep the information confidential. That duty of confidentiality is central to patients' trust in the dental profession. Um, okay. In conclusion, the need to maintain confidentiality of any information given to us in our professional capacity is paramount. Patient autonomy and their absolute right to confidentiality must be ensured is almost but the most exceptional circumstance. Thank you.
Informed consent. Informed consent is defined as the free assistance by a patient of a diagnostic or therapeutic cure and after having adequately communicated her clinical situation. Principle of consent. 1. All patients have the right to be involved in decisions about their treatment and care and be supported to make informed decisions if they are able. 2. Decision-making is an ongoing process focused on meaningful dialogue. The exchange of relevant information specific to the individual patient. 3. All patients have the right to be listened to and to be heard. The information they need to make a decision and the time and support they need to understand it. Thank you.